This is One on One. Sarah Lechner is the General Counsel at the New Jersey Hospital Association. Good to see you, Sarah.
Thanks for having me.
The Affordable Care Act has a big impact on a lot of folks, a lot of entities, hospitals. You guys represent hospitals, many hospitals in the state of New Jersey. The biggest impact on hospitals, and I know there's urban hospitals, there's suburban hospitals, they're not all the same.
Sure.
There's also hospitals in rural areas. Biggest impact in January of 2014 when implemented will be?
Well, it goes beyond January 2014, but our hospitals are going to see over a 10-year period $4.5 billion in cost reductions as a result of the Affordable Care Act.
Back up. $4.5 billion of what?
Of
Cost reductions.
Exactly.
What does that mean?
That means that the way that the Affordable Care Act is changing the way our hospitals are getting paid is going to result in those cost reductions.
Paid by the federal government.
Paid by the federal
Are they
government.
saying, look, we're changing the rules?
Yes, they are saying we're changing the rules, but that doesn't mean it's a bad thing. It's to improve patient care.
Give us an example. Give us one concrete, because this is one of our main obsession is consumer education. So sometimes when we talk about public policy, it's communicated at what I like to call the 8,000-foot level.
Sure.
We'd like to bring it down to the 8-foot level.
Sure.
A concrete example of how the federal government has changed the rules regarding what they pay a hospital for something specifically.
Sure. Best example I can give you is something that we're going to see come October, and it's going to be a reduction in the payment to hospitals when patients are readmitted. So what you're going to see is if a patient comes into the hospital, gets treated, gets care, is sent home, and then within that 30-day window comes back to the hospital is going to get dinged on that second
Because
admission.
what's the message that the federal government is
Sure.
attempting to send here?
The message is that we need to do a better job looking at the patient as a whole. We can't be just releasing them to the home, releasing them to another provider, and wiping our hands of it. We really need to be looking as a whole industry, not just the hospitals, but the post-acute facilities. We need to look together and help the patient.
You worried about that?
Our hospitals embrace these changes.
Because?
They're necessary. We came to the table when the Affordable Care Act was being negotiated. We support the Affordable Care Act. We think a lot of the changes are necessary. We think we need to go back to looking at the patient.
Because of cost and quality?
Because of cost and quality.
I'm interesting. Think about emergency room wait times.
Sure.
A huge issue here.
Absolutely.
With more and more Americans, 30, 40 plus million Americans who will now have health insurance when implemented.
Absolutely.
What will that do to emergency rooms and emergency room wait times?
I hate to say that we'll wave a magic wand and
so that's the plan?
Sure, we're just gonna wave a wand and our ED wait times are gonna go down. But seriously, it's definitely a problem, and it's a great point. It's not just about hospitals. Giving people insurance is a positive step, and it's going to help a lot of people. It's going to help the industry, but we need to make sure that we have enough physicians to care for them on a day-to-day basis. We need to make sure when they come into the hospital, we have electronic medical records so we know what medicine they're on, so that we can look at the full picture of the patient.
What about the fact that more patients will have health insurance? They get a room, they get tests, all good for those patients that have historically had to go through the emergency department, tougher time. Will it be harder to get a room? Will it be harder to get those tests when implemented under the Affordable Care Act?
I don't think that's an easy yes or no question that I can give you an answer to. I think that the way hospitals are changing, the way they're offering care, trying to triage better, trying to coordinate with the FQHCs, with
federally qualified health plans.
Healthcare
centers. Why are they so important?
Well, especially in urban areas, you see the FQHCs can be a primary care resource for individuals who, even now might not be able to afford insurance. And we're going to see their role growing as more people get insurance.
Sure, these federally qualified health centers are incredibly important,
Yes.
again, particularly in urban areas. They're not hospitals.
They're not hospitals.
But they provide health care, important
do.
health care. But many of those health centers federally qualified,
Correct.
identified by the federal government, deal with some folks who historically don't have access. And the other thing about the Affordable Care Act that strikes me as very important, significant, and worth talking about is that undocumented aliens,
Yep.
people who are not citizens, are not covered under the ACA, correct?
Correct.
What happens to them, and what are the implications in the hospital environment as well?
Sure.
Listen, I know all I'm doing is throwing really hard questions at you that it depends, and I know there are a lot of question
Right.
marks, but that is a big one, right?
Absolutely, it's an unanswered question. I think the bottom line is that we're going to continue to care for that population. We do now. We will continue to care for them. We get unreimbursed. We get reimbursed by the state for charity care for some of that population, and others that are uninsured. But we're going to continue to provide that care.
That won't
regardless.
change.
Absolutely
But
not.
but does that create a greater disparity between urban hospitals, who disproportionately will be serving that population, and suburban hospitals who will not, be just because there are fewer undocumented, I can't call them citizens because they're not citizens, undocumented aliens living in,
Asians.
individuals living in this country, who live in suburban areas? Is there a greater disparity potentially?
There's potentially a greater disparity, but don't forget, some people under the Affordable Care Act are going to choose not to get insurance. So remember,
What happens with them?
we will continue to provide services to them as well. But
No one gets denied.
no one gets denied. No one does now, and no one will come January 1, 2014. We provide services to everyone who comes through our doors.
So you know what's so interesting to me is, with all these questions, all these challenges, that your organization continues to be supportive. You're at the table.
Mm-hmm.
You wanted this to happen because you said it has to happen.
Health reform needs to happen. I don't think, whether you support the Affordable Care Act or not, everyone agrees that some type of reform to the system is necessary.
Does that mean that the status quo, for those who have either argued for it or we want to repeal, whether they, like to call it Obamacare, right? The Affordable Care Act, the status quo is absolutely not acceptable.
I think it's unsustainable more than unacceptable. You see costs are rising, people are chronically ill, they're getting sicker. We need to change the system.
We appreciate you representing the Hospital Association. Sarah Lechner, the General Counsel, you're an important voice in an important discussion.
Thanks for having me.
Thank you very much.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Healthcare Foundation of New Jersey, founded by the Jewish community, and by Health First New Jersey. Promotional support provided by NJ Biz, All Business, All New Jersey, and by the New Jersey Business and Industry Association and its monthly magazine, New Jersey Business. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.